I'm very happy to have with us another young Indian, smiling face. Luckily, uh, today we have with us right now Samiran Tripathi. Let's listen to him. Over to you, Samiran.
Yeah, thank you for giving me this opportunity. About when we started our conversation, at that moment I was a little unsure about, how am I fitting into this because as someone who likes to consume a lot of content on YouTube, I did immediately end up going through your channel and looking at the host of people you had to interview. And, a lot of them seem from the economics background and civil services background and quite, well-rounded individuals. And I am still finding my feet on the ground. Um, but yeah, it was good to know, and it is good to, finally get to do this. So here I am. I'd like to introduce myself. I am Samiran, as you've rightly said. You've not called me Simran, you've not called me Samiran, and I'm so grateful for that because one of my minor struggles in life has been trying to, get people to pronounce my name correctly in the first go. I'm a native of the city of Mumbai. And academically, I am a biomedical engineer. And then I went on to do my post-graduation in hospital administration from Tata Institute of Social Sciences, Mumbai. Thereafter that, I uh, have dabbled on across different spectrums of career in a very short span, starting with corporate, moving on to Public Policy Institute, taking a break for civil services, and finally ending up at an NGO, and not ending up, but right now at an NGO. But before that, before coming to, in depth of all of that, I would like to start with where I started my journey. That is my home. So growing up to parents who both have doctors in front of their names. My dad was a orthopedic surgeon. He was working with the government of Maharashtra for over 30 years. He diligently offered his services to the state government. And my mom is a developmental economist, and she has a PhD, of course, in economics. She's been associated with various colleges across the University of Mumbai. And growing up in a medical and a social sciences houses, there's nothing much more to read apart from either a Campbell's textbook on orthopedics or an economic and political weekly, because my parents did not align in terms of their careers, but they were together as parents, as people trying to raise me up. And I also come from a family which is also very bipartisan in this way. My mother's side has a lot of people from social sciences background, and my dad's side has a lot of clinicians. And we are ancestrally from Uttarakhand, more specifically from the Kumaon division, and out there from the beautiful place of Nainital and Pithoragarh, wherein my parents started their education and moved on to Bombay for better economic opportunities. Now, hearing about a myriad of issues, whether it was my dad who was getting frustrated as a surgeon and getting frustrated with his team about the team not getting enough supplies or enough support as a government sub officer, or maybe wanting more support because he wanted to do more for the people because he was working with the government, and hearing about my mom speaking about the social side of why things don't work the way my dad wants them to. I grew up somewhat inclined towards a career in trying to first understand the technical side of things and then maybe social sciences. And that's how it went for me. I took up PCMB as the holy combination in 12th, which is physics, chemistry, maths, and bio. And um, not to say anything else, but it was difficult dabbling between both the subjects because I wanted to take medicine, but I was also confused whether should I take engineering, wherein my friend came in to help me and he told me, why don't you choose the middle ground, which is the best place to be at, a biomedical engineering degree. I ended up with a decent rank, ended up in a decent college, and yeah, by the time I reached third year, however, I realized the technical side of things doesn't interest me as much as the social side of things. And even in our subjects, thankfully, because I come from Mumbai University, I would really like to thank them that they helped me indirectly by introducing subjects such as hospital management. And because I was getting to see how a hospital gets managed on a very practical, in front of my eyes way, I ended up liking that subject so much so that I ended up choosing it as my master's degree. And yeah, having read, having been influenced by the great Dr. Sundar Raman, who I had the fortunate, or had the fortune rather, of studying under him in my master's for at least one subject. I did happen to pass out from the Tata Institute of Social Sciences, the degree in hospital management, and therein I understood that, hospitals are not as isolated as our system is perceiving it to be. They might be standalone, but when it comes to the community, whether urban or rural, they do have the potential of being the focal point of everything that can reside with the community and around it. So, in my second year, rather in my first year itself, interacting with my fellow graduates from public health, I understood there's more to healthcare than just focusing on hospitals. And slowly I started paying more attention towards public health and that why public hospitals are not getting the support uh, that they deserve. Primarily, they cater to three-fourths of the India because three-fourths of the India still lives in rural parts of the country, or well, two-thirds or 70% or whatever the metric is. A majoritarian part of the country lives in the rural landscapes, and there we do have district hospitals, we have community health centers, we have the primary health centers, the whole triage of, the public health system, which is not efficiently run enough by people who are at the upper echelons, I feel. Still not being efficiently run enough, things can be much better for people. And this is not to say that, private hospitals need to take up this point because it's not in their ambit. I don't believe that a top tier private hospital should take it up. It's not their part. Their part is just to try to take care of people and maybe generate some profits for their shareholders if they're a listed firm. However, uh, having that soft corner for people, I thought maybe let me just try to gain some exposure first in the corporate sector, and maybe after a few years, I might switch towards public health when I have completely or at least somewhat understood what the corporate career in healthcare looks like. Having been enamored by it, having friends who are still doing very, very well in their corporate careers, I did think, maybe let me give myself a shot. However, some inclination was always there to work with communities, and it's always been somewhere, like I said, in the back of my head to, be or do something with communities. And then, finally the push came when the COVID crisis hit us. I started my career with genetic diagnostics. I was working at this firm in Hyderabad in in marketing in genetic diagnostics, wherein our clients were major public health hospitals, private hospitals, who had genetic testing available in their facilities. These are centers of tertiary and even quaternary care. And while I realized that, this place is a blue ocean, or rather, this sector is a blue ocean, more so a light blue ocean, to be honest, I just felt we haven't focused. Again, the public health thing came in my head that, why haven't we focused anything more on genetic testing towards congenital deafness or towards children with Down syndrome? Why hasn't testing become more rampant or more upscaled despite having numbers for it? The government, to say, did not try at all. Of course, that's not there. They did come up with the project Umeed in 2019. However, that project still seems to be like a project and it's not a full-fledged program. to the scale of, let's say, a mission Indradhanush is, because priorities differ, governments tend to cater to what's working very well for them, and they would like to continue working more towards that side. However, organizations have been pushing for genetic testing for children, and even genetic testing for things like PCOS, or what can be done towards improving things. So the question arose in my mind while working at 11:30 in the night trying to prepare a beautiful presentation, that why haven't we done more as a society in terms of genetic testing? And wherever I used to go, or whoever friend I used to meet who was there in corporate healthcare, I used to be the annoying person at the parties, wherein I would ask, Acha, you guys have done this, why hasn't this been done in public health? My friends slowly started asking me that, listen, you love this field so much, why don't you try something out there? And that's when I also felt, if I've started subconsciously speaking so much about it, maybe I should try to switch for it. And that's where I took the first leap. I moved on from Hyderabad, came back to Bombay, my hometown, to this place called TERI, the Energy Resources Institute, wherein I was working in public health and nutrition. Uh, that's where I got the first taste of, what public policy looks like. Until then, it was just public health for me. But when I got the chance to, understand that how health is not an individual subject, but it is very, very intrinsically and entrenched with other parts of society and other parts of, the environment, whether it's air, whether it's nutrition, whether it's just access to roads for walking. One of my professor in TIS used to say, and I still really, really remember that quote, where he used to say that, you can ask a diabetic patient that why haven't you walked enough to try to control or manage your diabetes? That's a very difficult thing for that person to answer, because what if that person does not have access to proper walking spaces? You can't fault the person for it. If there is enough spaces, but then you can't, and if the person has not walked, yes, then of course the person is at fault. But most urban cities in this country do not have enough walking spaces. And all of a sudden, while working at one of the projects in Terry, it just dawned on me, oh yeah, now I get what this man was saying. Thank God I did not fall asleep in his class. So that's where Terry gave me the first inclination towards understanding what public policy is. And I started reading up more on multi-sectoral aspects of healthcare. And during that time, another thing happened wherein, the COVID second wave peaked, and our system showed that it is not at all resilient, the public health system rather. Private health was still doing quite well. We do know how occupancies were working in private hospitals, and, there was a shortage of beds and everything. But therein, our public health system was failing, if nothing else. And um, that's when I figured out, or that's when I, decided to be like first 4 months within Terry. And I was like, no, I don't think this is also the right place for me. I took a shot at civil services, primarily not at the UPSC, because I felt it's too big a fish to fry. I wanted to work in my native state of Uttarakhand, wherein since childhood I was getting to hear through my family members, whether my mom's side or my dad's side, that there's a myriad of issues that affects the mountainous people and the mountainous communities. Decades of negligence, decades of neglect, lack of proper infrastructure, whether it's healthcare, hospitals, urban transport, rural transport. Uh, that all has, shown very clearly in the face of the COVID crisis. And I decided to give it a shot. So I started preparing for about 9 months for the Uttarakhand Civil Services. And yeah, it was quite an interesting preparatory phase for me. My friends were repeatedly requesting me not to quit my job, because jobs at that time were getting difficult. But thanks to my mom, who was primarily my support emotionally and otherwise, she told me, no, if you do want to go for it, then you do go for it. However, it's going to be a very boring job if you do get selected, because bureaucracy is not as cheerful as they do show in those movies. And yeah, I did spend about 9 months preparing for it. I did have a very interesting session learning from starting from a very specific knowledge about public health and healthcare and hospitals and being an allied healthcare professional to, going back to something that I dread the most a lot. It's ancient history. I do not know how do people manage to get through that aspect, but for all of you who do clear the civil services, my God, ancient history for me is my biggest fear. And yeah, unfortunately, I could not manage to clear it because my blockage of ancient history did end up getting to me. Um, I did fail the attempt, and because it was a state civil services, they do end up happening, once in 3 years, 4 years types. They're not very frequent. Uh, so I said, no, I'm not waiting for the next one. I am trying to find my feet again. And as the movie 12th Fail said, restart. I did end up, restarting, started scratching my head. What do I do? What do I do? Until one fine day, I figured it out and I said, you know what? I'm going where my grandmother was in the beautiful, beautiful place of Nainital. And I'm going to find an NGO and I'm going to give whatever I have, whatever they need. I did not know whether health would be my thing or it could be any other sector. I was willing to give whatever I had for the organization that was. And I said, you know what? Let it be. Let me just try to find my feet with my community. Let me start somewhere with them and let me see where does it take me. Fortunately, I ended up with this beautiful organization based in, the scenic place of Mukteshwar called Satoli. The organization's name is called Aarohi, and I've been there for 2 years. They were coincidentally looking for someone in healthcare, and I had a specialization in healthcare, and I had an understanding of the community because I am natively from there, and I speak the language because my parents did speak it at home, rather the dialect. So I am very well versed with Kumaoni, and I just shamelessly offered my candidature to them. Did not even ask them what my pay was going to be. I said, you know what, doesn't matter to me. My sector's aligned, my community is aligned. The needs of the people have still not been met. I said this is the perfect triangle wherein I could start my, or rather restart my ambitions towards working in public health. And yeah, it's been 2 years, nearly 2 years, still not 2 years, and we are doing some good job. We have been in the work since 1992, and we are based across the 6 districts of Kumaon, which is all, Pithoragarh, Almora, Bageshwar, Nainital, Champawat, Udham Singh Nagar. We are basically in the whole of Kumaon, and our plan is to expand within the next few years, maybe to Garhwal. We work in healthcare, education, livelihoods, and natural resources management. I have found myself to be in august company of my director, who's brilliant man to learn from. He's a very humble, down-to-earth man. He's a very funny man also. He has a doctorate in forestry from Nainital. And yeah, my program manager, the person who leads the healthcare vertical, is also from TISS. We do have a lot of fun thinking about, the times back in this, because in our own campus at Aarohi, we do have something like an amphitheater, and all of those who studied from TISS, they do know what the amphitheater means. It used to be the place for all the students, irrespective whether you're an MPhil or a PhD or a master's or even just a friend of the student, everyone chills at the amphitheater. And we do have an amphi in our own campus. And yeah, we do have quite a big workforce. We have 150 people, of which 40 plus are in healthcare, and I get to co-lead the team with my program manager. And we work across delivering unmet needs through comprehensive primary care and also some secondary care because we run our own small hospital which has a full-fledged OT, but we do elective surgeries out there and not emergencies because the required capabilities are still not there yet. Maybe in the future, if the needs are pushed on by the communities, we're a very community-driven organization, but that does not mean that we get budged by them. But yeah, we do have the first ear given to the community. And yeah, so this is a brief about what I get to do. Oh, sorry, you're on mute.
What is it that you do?
Yeah, so I primarily take care of the operations management, wherein operations and strategy, basically, wherein, I take care of the hospital's functioning. I also take care of the community health program, any particular issues related to the operations or forging new partnerships with stakeholders or streamlining processes. That's where I primarily come in. And apart from that, I have also started working on improving the documentation process of the organization and also digitize my firm, which has been quite a big challenge because, organizations have their set ways and we uh, have a lot of staff who are resistant to change. But thankfully, they've been quite cooperative enough because they understand, if we don't digitize, whatever we have right now might just perish. So
Mhm.
they've been quite supportive of that. So primarily, operations management and also, yeah, documentation is what I take care of.
Okay.
Yeah.
Um, is there any interest in telehealth in your organization?
We do have some interest with telehealth, but the problem is that our healthcare program primarily works in some of the most backward dis blocks of Nainital and Almora and Champawat districts. Now the problem is we can't have a full-fledged telehealth system as much as our organization itself likes to have, uh, because simply for the fact that some of the places where we work in, our community health staff cannot reach out to us because of lack of network.
Yeah.
So we have started a very small uh, part of telehealth wherein we have a pool of radiologists and we have connected them via WhatsApp.
Mm,
So any cases that come to our hospital or are reported by our field staff, whether let's say it's a fractures case,
mm,
and what happens is an X-ray is taken and the X-ray is shared on the WhatsApp group and the basic details about the patients have been given.
mm.
And our radiologists who are ex-army personnel are kind enough to respond to us and further treatment gets advised.
Okay.
So some aspect of it, but not fully like a full telehealth system.
It's the back end. You're just working on the back end.
Yeah. Yeah.
Not front end's not possible.
Not yet. Not yet. Not yet.
Okay. Wonderful. It's a great journey, and I'm sure you're doing good work there. Uh, who's funding you?
Uh, Across sectors, we have different funders. In healthcare, we are currently funded, by the Azim Premji Foundation. Prior to that, we were supported for 3 years by Bajaj, and prior to that, we were supported for about 15 years by the Tata Trust.
Okay.
So, yeah, primarily it's been institutional funders, but we also do get a good amount of individual donations. So, and also we do generate our own revenue, not enough to, take care of the operational expenses, but yeah, about maybe let's say 15 to 20% of the expenses do get taken care of.
Okay. So it's stable right now.
Yes,
Revenue
it's
flow is
stable.
not, you are not
Yeah.
spending your time hunting for funds. You are really,
No, no, no. For last year, 6 months, we were, transitioning between funding cycles. So there were some hiccups that we experienced, but still the organization's leadership is stable enough to, not go through any drastic measures. So yeah,
so what's the biggest
we are.
challenge you are facing? You as an individual, not as the group. What's the biggest challenge that the most frustrating that you wish you
Oh,
could resolve, and just to get a sense of what is it that somebody has to overcome?
so sometimes with the rate of which I end up working with, people do not end up matching my frequency.
Okay.
Let's say if I'm at 100, they end up at being like a 60 or a 70. And since I am slightly young, I do get impatient sometimes, wherein I don't realize immediately that, oh my God, this person will not be able to function at my 100. Maybe what I'm thinking is his or her 70 is their 100. So I need to be more patient with that. And yeah, sometimes I do struggle with that.
Yeah, but
Um,
that's not what I'm looking for. I'm looking for a specific issue.
mm, One specific issue would be managing my personal time.
Okay.
I end up giving quite a lot of time at my office because I do love my work a lot. I do genuinely love it, and more often than not, I end up dreaming about it also that, oh, this could have also been done, this can also
Mm,
be done.
mm,
I end up sacrificing my own personal space and my own personal life
mm.
because despite working at an NGO and the normal thought that people get about an NGO is that, oh, it's gonna be like a 9 to 6 life. It is completely opposite to that. And by the time I'm back at my place in Satoli, I have no time for myself.
It's six
It's
to
either
nine,
dinner
not
time.
it's not 9 to 6, it's six to
Oh
nine.
yeah. Oh yeah. It is 6 to 9. Very, yeah. Yeah. Very
Right.
well said. Yeah.
Yeah, it's 6 to 9.
So I
Okay.
do end up struggling. I have been struggling with my own self, my own hobbies, my
Yeah.
interests. I've taken a back seat.
Mm,
And my sometimes even I have felt that my relationships have taken a back seat. I'm not able to keep in touch with my friends.
mm.
My friends are not very happy about that, but they do understand that, he's trying to build something out there. So they're patient.
Okay.
And I'm really, really supportive of them. I mean, they are really, really supportive of me rather.
Okay. Do you do any field visits?
Yeah,
Huh?
I
So
do.
what has struck you the most from them?
Uh, that the communities are very resilient, very, very resilient. Especially the women, because with most of our work primarily catering to mother and child health, we get to interact a lot with women stakeholders, whether it's the beneficiaries, let's say pregnant women, or geriatric women, or the ashas, or anyone who has something to do and is primarily identifying themselves as women. They have a very, very hard life. My own landlord's wife starts her day at 5 in the morning and ends up having, to work till about 9:30, most of which is, of course, considering unpaid labor work. And yeah, she's been doing that for ever since, yeah, quite a lot of time. And yeah, women out there are very resilient, very headstrong. And that has just, yeah, I've not been able to shake that point. And I wish I could get some of that strength, but
Mm.
it comes at a cost for them.
Okay, my last question. There's been a discussion about this, not with respect to Uttarakhand. What's the water supply situation in the areas that you have visited?
Um, So it's a mixed, I'll give you a mixed answer. Where I currently stay in Mukteshwar, it's a peri-urban area, and there is a water scarcity issue. Uh, it has started right now, and we have not even hit summer, and it's just March. Uh, but in some of the areas which are also our field areas, like let's say the Okalkhanda block, the Dhari block, there doesn't seem to be enough of a water scarcity issue as maybe a Mukteshwar or a Ramgarh block faces, because with increased haphazard urbanization, we have seen the water levels to drop. And yeah, so it's a mixed bag, sir. Where I stay, there is a water scarcity problem.
But is it piped water supply or well
Tanker.
tank?
Yeah, we have tankers running around right from last week. I saw one before coming back home for Holi. I did end up seeing a couple of tankers across the day. And yeah, those are the signs.
So how the poor people are able to afford the tanker water?
Um, some of them have their own water sources. Some of them have storage sources. So because also there's a lot of community-based living out there. So water does get shared, and it's a very flexible environment when it comes to those communities out there. They do take care of each other's needs quite a lot when it comes to the basics. For the rich out there, yeah, the tankers do help them out. And the problem also is that, so, whatever construction that gets taken place out there, a lot of the water that gets used is potable water. So, I mean, you've anyway started on a low, and then you end up using that for construction, which means it even troubles us even more. And because my area particularly is not a very rain-fed area, it's a more of a rain shadow area. So water through natural sources like, let's say, rainfall also becomes a bit of a problem. However, people are managing for now. They do have their, like I said, shared sources, their own sources, judicious use by the poor, unfortunately. But yeah, they are managing for now, but I don't know how long can this be sustainable.
All right. Okay, good. Thank you so much. Anything else you want to add here?
No, not really. Thank you. Thank you for giving me this chance to share my view. And yeah, thank you so much.
Okay, let's end it here today. Let
Yeah.
me say bye to the viewers, and I'll be back with another expert or young person, or a young person who's an expert like we have here, who is really quite an expert, though he's quite young. But
Far from it, sir. Far from
okay,
it. I
all
get to
right,
learn
so
from people like you.
all right, let's end it here and let's say bye. I'll be back. Okay, bye bye, everybody.